Hello, my name is Jackie Mauricio, and the psychological disorder I chose for my Psychology 101 video submission is intermittent explosive disorder. Intermittent explosive disorder is a chronic mental disorder characterized by episodes of unwarranted anger or behavioral outbursts that are out of proportion to a situation. It falls in the category of impulse control disorders. This disorder usually begins in the early teens but can be seen in children as young as 6 and is most common in people under the age of 40. When young children have this disorder, they usually have been diagnosed with other disorders such as reactive attachment disorder, or RAD. The cause of intermittent explosive disorder is unknown. However, there are contributing factors such as genetic components, verbal and physical abuse in childhood, a history of mental health disorders, and a difference in brain chemistry. The disorder is shown through temper tantrums or outbursts that last less than 30 minutes. After an outburst, feelings of relief, regret, and embarrassment may be experienced. Outbursts can cause significant distress, negatively affect relationships, and can have legal or financial consequences. Symptoms of intermittent explosive disorder are rage, irritability, racing thoughts, increased energy, tremors, and palpitations. Other signs can be road rage, domestic abuse, and throwing or breaking objects. Adolescents with this disorder have low frustration tolerance and are unreasonably enraged by small annoyances. To be diagnosed with the disorder, a person must have displayed verbal or physical aggression toward property, animals, or other people 2 times a week for a period of 3 months. A person can also be diagnosed if they have had 3 aggressive outbursts that result in damage to property or physical assault that involves injury within a 12-month period. Usually, outbursts are brief and impulsive and not premeditated. 1 to 7% of people will develop this disorder during their lifetime. Treatment can be a combination of therapy such as cognitive behavioral therapy or psychotherapy and medication. Fluoxetine is the most studied medication for this disorder, but other medications that can be tried are antidepressants, anticonvulsants, and anti-anxiety and mood regulators. Centers such as the San Diego Center for Children provide intensive short-term residential treatment for children ages 6 to 18 where they can participate in therapy. Coping techniques that can help prevent episodes are relaxation techniques, cognitive restructuring, communication skills, and avoiding alcohol and recreational drugs. Intermittent explosive disorder is a long-term condition that can last from 12 to 20 years to a lifetime, but can be managed with proper treatment.